Hi, my name is Dr. Gustafson. I'm a naturopathic doctor. I'd like to give a little information about what a naturopathic doctor is and what we do. Um, there's a lot of information out there that can be confusing about who we are. Um, we're actually an interesting combination of historic medicine, going back to Chinese medicine, homeopathy, all the way up to modern day medicine where we're doing environmental medicine with IVs and microcurrents and things like this. Um, the easiest way for me to kind of explain what a naturopath does is to compare an MD, or what we call an allopath, with a naturopathic doctor. And we have a lot of this similar training up to a point, and then we go different directions from there. Naturopathic doctors start with a four-year degree. My four-year degree is a bachelor's in science and kinesiology, which is the physics of movement. And we have to do all the prerequisites, biochemistry, physics. We have to do organic chemistry, which was pretty tough for me. Some of you may have slid through that one pretty easy, but and then we do, so it's basically the same thing as allopaths, what they have to do to get into medical school. And then we start into a four-year medical degree, which is, again, we start the first 2 years with our basic science of anatomy, physiology, biochemistry, pathology, how to read and interpret labs, and how to read and interpret radiology. And we're also taught pharmacology, right? So we're also taught how to write prescriptions for medications. Now, the other thing that naturopaths have is hours of training in a variety of modalities, everything from acupuncture to physical medicine, which could be anything from diathermy to microcurrent to TENS units to therapeutic adjustments. We're taught botanical medicine, homeopathy, lots of hours in nutrition. We're taught hydrotherapy, environmental medicine, IV therapies. It's grueling. It was a lot of work. And then at 2 years, we start into clinical shifts. We start working with patients, and we're also at the same time doing didactic courses. Now, I want to say something for my own self as a naturopathic doctor, and that's I'm not against medications, and I'm not against surgery. I believe there's a time and a place for medications and surgery. Not all naturopaths are going to agree with that. Now, I worked as a firefighter on an engine, and eventually an engineer for the fire department, and boy, I saw plenty of times when a medication brought somebody back. Now, I will also say the number one drug I saw used, are you ready for this? The number one drug was actually oxygen. I saw oxygen help more people than I can count. And really, that's one of the reasons why I love oxidative therapies and oxygen treatments. Anyways, so I'll talk about that at another time. So let's talk a little bit about how the two types of doctors might approach a patient's problem. Now, this isn't how every doctor's going to do it. Not every MD is going to approach it this way, and not every naturopath is going to approach a patient's symptoms this way, but this is very general. So let's see, when MDs and NDs, when they do an intake, they're going to ask you some questions. They're going to ask you about your symptoms. They're going to take your vitals, your blood pressure, your pulse, temperature, height, weight, those kind of things. They're going to evaluate your labs. They're going to do a physical exam. Most of them. I like to do physical exams because there's so much information in them. Whether it's a neurological exam or a cardiac exam. So we both do those. And then, we look at your lab, we look at your laboratory findings. Maybe we have to order some imaging studies or something like that. We are all pretty much on the same page with this. Now, there comes a difference at this point, right? So we take your information and then we form a diagnosis. And the information comes from what we talked about, right? Your symptoms. The information comes from your laboratory findings. The information can come from the physical exam. And we take all that and we come up with a diagnosis. So what do we do with that diagnosis? Well, as a naturopath, I can tell you what I want to find is the obstacle to cure. What an MD will most likely do, not all of them, will most likely do is prescribe a medication. And as I said, in some states, naturopaths will or can prescribe medications if they want to. But we'd rather not as naturopaths. We'd rather use some other form of treatment to help support your body to heal. And basically is just physiology is what we're looking at, and your biochemical pathways and supporting them in the healing process of your body. Now, where do we go from here? So let me give you a real general idea of a patient and how a patient might be treated. Let me give you a little story. So you're driving down the road and your dashboard light goes off, your oil light goes off, and you think, okay, I'm going to take my car to the mechanic. And you take your car in, and the mechanic says, this isn't a problem. You know what we're going to do? We're going to cut the line that goes to the light. And when we do that, you won't see the light anymore, and it won't be a problem. That's a very simplistic way of saying what a medication does. It stops the symptom. Now the symptom would be the dashboard light, right? You see the oil light, that's a symptom. Now that symptom could be pain, it could be rapid heart rate, it could be coughing, right? If we give you a drug, it cuts the symptom away. Now is the problem still there? Most likely, right? There's probably still a problem. What happened? Why is your heart racing? What's going on? What is the underlying issue? Is a drug really the reason why your heart is racing? As naturopathic doctors, we don't really look at it that way. That doesn't mean that I haven't prescribed heart medications when I worked in Arizona. Oftentimes, you know, I had patients with high blood pressure where they needed some help. Now, did I try and then also find a way to support them to heal so they eventually didn't need the medication? Yeah, that's how I work, right? That's how naturopaths pretty much work. So anyways, let's say, what type of patient do naturopaths see? Well, naturopaths see everything because what we're really trying to look at is to support your vital force. Now, if you see a child running around, and you try and keep up with them and it's exhausting, that's vital force, right? They're just full of vigor and they want to run around. That's vital force. That's what we want to bring back. That's the health that we want to support. That's what we're looking for as naturopathic doctors. How do we bring that back in a patient? So, you know, and it can take some time and some work, by the way. So what is it that we see as patients? I mean, that walk into our offices? I can say for myself, I've seen everything from Lyme to HIV to IBS. I have patients that have cancer. Can I treat cancer? Nope, it is not legal for me to treat cancer. However, I support patients that have been diagnosed with cancer. What modalities do I use? Well, everything from ozone therapies to, gosh, you name it, IV therapies. I do physical medicine. I do applied kinesiology. Botanical medicine is amazing. Homeopathy. Our toolbox is huge. We have a huge toolbox as naturopathic doctors. Now, do we all use the same tools? No. Some naturopaths will focus on homeopathy. Other naturopaths will focus, like myself, on environmental medicine and addiction. So everybody's just a slight bit different, right? It's just like you have your MDs that have different focuses that they work with. Now, one of the last things I want to say for myself as as a naturopathic doctor, as an ND, is I work well with MDs. I love MDs. I work with two right now that I absolutely adore and respect. Is that the case with all of us? No, unfortunately. I just hope that on some point we can learn to work together in a good and healthy way because it's really about the health of the patient. Um, but I've been blessed to find some really good MDs to work with. I've also worked with a lot of really good NDs, like Dr. David Arneson is one of my mentors. And then on the other side was Dr. Josephs in Scottsdale, Arizona, so who was an MD. So, I think you get a foundation in school and then you go out into the real world and you really start learning. And I will say that there is so much to learn that don't cut yourself off from learning from both types of doctors and chiropractors. I'm sorry if I sound like I'm just saying the two because there's other types of doctors also. I learn a lot from chiropractors too. Um, Anyways, I hope that gives you a simple idea of what a naturopath is. Um, you're welcome to come into my practice. I would love to see you. Thanks.